Well, it is the start of the Medicare annual enrollment period, and if you're enrolling for the first time or evaluating different Medicare plans, you may be searching for answers or additional resources to inform your decision. Medicare can be complicated, but Select Health has some tips to help people feel more confident about selecting the right Medicare Advantage plan. So we're joined right now by Trent Nate from Select Health. So good to see you, my friend.
Likewise.
All right, so for those who are not familiar, tell us who is Select Health?
Sure. Well, thank you, first of all, Melissa, for having me back. Secondly, Medicare is not nearly as exciting as monster trucks or delicious food, but it's important nonetheless. So who is Select Health? Glad you asked. We are a not-for-profit health insurance company. We actually operate in 3 going on 4 states in the Intermountain area. So Utah, Idaho, Nevada, soon to be Colorado. We serve over 1 million members in those states. And actually just celebrated our 40th anniversary. So been around a while. We're here to stay. And we're local. Our team, we have offices here in Meridian, also one over in Idaho Falls. We work, we live, we play in the communities that we serve.
Brilliant. Okay, and then we already mentioned annual enrollment period. Yep. It is open right now. What are other dates that people need to be aware of, and who can you imagine might be impacted by these dates?
Yeah, good question. So AEP, or annual election period, is December 7th through, or excuse me, October 15th through December 7th. So that's really the big date to keep in mind if you're a Medicare beneficiary, is December 7th. So we got a little bit of time, but don't delay because there's a lot of activity, and procrastination obviously can come at a cost.
Yes, it will come at a cost. And what are some of those important things that people need to consider when choosing a Medicare Advantage plan?
Yeah, excellent question. Medicare Advantage plan is kind of an all-in-one plan. So it has basic medical coverage, hospital coverage. Most of them have Part D prescription drug coverage. So the most important thing is to make sure that it's a good fit for you. Has your life changed in any way? Do your needs for insurance have a necessary change? So that's first and foremost. You want to look at things like an out-of-pocket maximum. The other nice thing with Medicare Advantage plans is they have some extra perks per se. So vision, dental, hearing aid coverage in many cases. So you want to look at that. And the last thing I'll mention is a star rating. And that's actually a rating that comes from Medicare that allows consumers to easily assess how good a plan is. So it's a 1 to 5 stars. And this one's pretty important and special to us because our HMO plans actually have a 5-star rating, which is really difficult to get. There's over 40 different criteria that are evaluated, including customer service, also what programs we have in place to help keep our members healthy. We're the first in Idaho, and this is actually our 3rd consecutive year. We're still the only 5-star plan in Idaho, so pretty good deal. Yeah,
that's a huge deal. Yeah. Yes, okay. And if people watching would really like to get ahead on this, though it's already started, everyone, just to let you know, where do they go? What do they do? Because I know that you have a really great support group as well to help people choose the right plan for their needs.
Absolutely, and there's a variety of directions we can go. One, you can call us. We call them the Answer Team, very specialized, super knowledgeable folks that are here to help. We also highly recommend that folks connect with an experienced licensed agent. There's a fantastic agent community here in Idaho. They're easily accessible, they're knowledgeable, and can help direct people into the right solutions.
Wonderful. Yeah. Trent, thank you so much. Greatly appreciate it. And make sure you check out Select Health Medicare. It's .org, right?
Correct. Okay. ORG.
Yep. And you can also call the number on the bottom of your screen as well, too, for that wonderful support group that you had mentioned, or network, I'm trying to say, for Select Health, to make sure that you're navigating this, because this can be really overwhelming, right?
Absolutely.
And we want to make sure everyone's making the right decision for their needs and their families.
For sure.
Awesome. Thank you so much, Trent.
Thanks for having me.
All right, everyone. Thank you so much for joining us here on Idaho Today. And